upper laterals, severe rotations, like in this case, we have to carefully plan the movement because we know the size of these teeth is usually smaller than the rest, for example, the canines or the central incisors. Therefore, being really important to carefully stage the movements, especially if we have limited treatment plans like a light package with Invisalign. In this case, we have these two upper laterals, which they are proclined, they are out of the arch, and we have to stage the movement. Since the upper incisors are slightly retroclined, we will plan the treatment slightly proclining just the crowns, trying to make a crown movement instead of moving the apex. And then, whenever they are aligned to the laterals, we will over-engineer the rotation, making some mesial in movement. So, as you can see, we start the case creating some posterior expansion, central incisors proclination, and at the end of the treatment, then we start with the over-engineering. We exaggerate the rotation of these laterals because sometimes we know it's complex to achieve the ideal position. And this is why in these cases, for a non-predictable movement, we will focus on this over-engineering, this hypercorrection of the movement. Also, as you can see, there is some slight IPR in the front side of the patient. This is because there is an asymmetry of the gingival aesthetics of the patient. So we are intruding the upper left lateral. We are also over-engineering the intrusion using an attachment of extrusion in both adjacent tooth, in this case upper right central incisor and upper left lateral incisor, to create a counterforce related to the intrusion. So we know this movement is going to happen. But again, we're planning the over-engineering of the intrusion is slightly higher than the other upper right central incisor to make sure the final clinical result is perfect in only 14 aligners.